our healthcare system is the best in the world at taking care of you when you get sick. So my point is, I don't want to get sick. I don't want to be unhealthy.
Who wants to get sick?
So I'm going to do the things and help my patients do the things to maintain their health, their vitality, and live life to the fullest.
My name is Gibb Clark, CEO of YourEra.com, and it is my distinct honor today to be on the Everything GLP-1 podcast with the Dr. Tom Lavin. Our topic today is biology versus willpower. Weight loss failure isn't a character flaw. It's a biologic reality from how we were wired thousands of years ago. So, Dr. Lavin, can you tell me a little bit about that?
Yeah, the whole idea of biology versus willpower, for so long, people had the assumption that if you just, walk more and eat less, you can lose weight. And there are all these programs that we watch for years and years that were ultimately failures because we are evolutionarily wired with these neural and hormonal pathways that maintain weight, and they drive us to look for weight and to eat. And the more calorie dense, the more it drives us. So, and this has all come to light over the past several years. And I like to, from an evolutionary standpoint, just talk about how long this has been going on.
Yeah.
So if you think the Earth has been around 4.5 billion years. Life started 3 billion years ago. Dinosaurs have been extinct for 66 million years. And we, humans, have been on the planet for about 300,000 years. So it is a small speck in, the duration of Earth and life. But during that 300,000 years, we have been evolutionarily wired to search energy and search food. So if you think about it, during that period, I like to think of a 1,000-page book where each page is 300 years. That's your 300,000 years. And for about until the last 4 pages, there was no food. It was scarcity. It was starvation.
Yeah.
So we were hunters and gatherers. So we were just wired to search food, and the alternative would be to starve. Then we hit the agricultural age, which would be the last 4 pages of the 1,000-page book. And that's where we learned how to farm and make a product. Food was still very scarce during that period, but then the last period, the industrial age, the last 150 years, which if you think about it, in this book, it would be the last half of the last page. So we have this evolutionary wiring going on for 999 and a half pages. And then that last half page, suddenly food shows up. And then you get into the ultra-processed food, which is actually the last 50 years. So that'd be the last paragraph on the last page. So suddenly we went from this evolutionary wiring to search energy, search food, to now it's everywhere. Calorie dense, ultra processed foods. And so no wonder we're struggling so bad with obesity.
That's right.
So what's happened now, GLP-1s have been not discovered. We actually discovered them in the 80s. The first GLP-1 was approved by the FDA in 2005, so that's 20 years ago. But the whole problem is GLP-1s in our body come from the ileum and the colons, from our GI tract.
Okay.
And they have about a 2-minute half-life. So they're gone in 1 to 2 minutes.
Yeah.
So they don't really have much of a long-term effect. It's episodic for when we eat.
So it's almost like the the card deck is stacked against us just naturally from thousands of years of really just evolution to now where we are today. It's almost like these GLP-1 medications are, really introduced at just the right time, right when we're struggling, right?
No, it's exactly right, because GLP-1s in our body are there to respond to food. So they're going to tell us after a meal that we've eaten. They're going to shut down our hunger and cravings. They're going to cause our pancreas to release insulin to drive our blood sugar down. So the problem is they're very short half-life and they're
Yeah.
episodic. So the goal of these longer term GLP-1s was to create something that would last for a whole week, which is what
Wow.
we have now in semaglutide and tirzepatide. So these GLP-1s now counteract all the impacts in the brain where they decrease your food noise, decrease hunger and cravings. They overcome all of these evolutionary
Yeah.
drives that have set us up for failure in the modern food age. So they have come around, like you said, at the right time, and the downside is very low. I mean, if you're dosed properly, there is nausea in some people, but it's more temporary. If you get your dose right, it basically helps you take away your hunger, your cravings, gets rid of the food noise,
Yeah.
gets rid of that dopamine drive to binge eat and for impulsive eating. So it really counteracts that. And people that live with that food noise and hunger and cravings and inability to really stop eating get such a peace when they suddenly have no more food noise or hunger and cravings.
Yeah, I can speak from personal experience. My wife was a early user when GLP-1s first started coming to the forefront, and she described essentially basically what you just described. Like the food noise was gone. She was able to achieve her goals, but it really helped almost rewire, her brain in a way where she was able just to achieve those weight loss goals. So I've seen it
Right.
firsthand.
One of the questions is, and I help people, you know, first start with the weight loss, and so we get them dosed properly. We have something called the green zone concept, and where patients are in the right zone, they have the right dosing. If it's too low, they don't. They have food noise and hunger and cravings. If it gets too high, they end up with nausea. So I tell patients, understand this green zone concept and then remember that when you're taking your GLP-1, because the goal is to dose you appropriately and slowly go up on your dosing so you don't go up too fast. But over time, you become resistant to the same dose. So you have to bump the dose to get back into the green zone.
Yeah, that green zone concept, it's something that we have loved incorporating at YourEra.com. But back to your patients, obviously you've been treating patients for over 30 years, wide array of experience in the weight loss arena. How many of your patients come when they first come to you just feel like they've just failed, right? And what does that next step look like for them?
Yeah, I try to empower patients. I tell them, be the CEO of your own health. You don't need to take direction from someone else. We're going to give you the material and the understanding so you can take charge of your own health. So I tell patients, let's get the weight off first. And so we get them dosed appropriately. We shoot for about 8 to 10 pounds a month, and get them, over 3, 6, 9, 12 months to the right weight where they completely feel healthy. And then some patients want to go off the meds. Some people we just drop to a microdosing dose
Yeah.
that gives you a lot of the benefits of the GLP-1s as far as health without the weight loss drive.
So we want to get into a little bit about the science behind this, which you obviously are very well versed in. And you mentioned something earlier that I thought was pretty interesting. You spoke a little bit about this neurohormonal imbalance. Can you expand a little bit on that and what you mean by neurohormonal balance? Maybe for someone who hasn't attended med school and been practicing for 30+ years. So.
Absolutely. These pathways are very complex, and we really didn't know them 10, 15, even 5 years ago. We didn't understand them. But these neural and hormonal pathways involve different areas of the brain, like the arcuate nucleus in the hypothalamus, that really is the hunger center for the brain, the hunger and cravings. And the GLP-1s stimulate something called POMC cart neurons, which create satiety, which means you have no hunger or cravings. And so the GLP-1s are very effective in that area. They also have an impact on something called the mesolimbic pathways and mesocortical pathways. Mesolimbic pathways are pathways involved with impulse and compulsive uh, gambling, eating, drug taking, a lot of that, and think of this area as the dopamine surge area of the brain. So the GLP-1s drop the dopamine peaks, so your reward seeking diminishes, meaning let's say you see a pizza or you can smell it, that's your cue. Normally you'd have this huge dopamine spike. Well, the GLP-1s drop it way down. So now you can smell the pizza or see it, and you don't have that drive to eat the pizza. And it appears that applies for narcotics, alcohol, tobacco, gambling, scrolling on the internet. A lot of these compulsive, impulsive habits that are negative are positively impacted by GLP-1s. So there's a lot of research going on in this area also.
Wow. So that late night bag of chips at 10 p.m. that I want to eat, I'm going to be holding back a little bit.
Yeah, you won't have the drive.
Okay.
When you look at the chips, you won't have the big dopamine spike. It'll be muted, and so you won't have the reward seeking drive to go get it.
All right, so Tom, very, very interesting. I feel like I just got a master's science class in GLP-1 and neurohormonal activity there. So that was very, very good. You started to mention some other areas outside of just core weight loss that GLP-1s can be so effective in. And we're starting to see a lot of that data come out now that GLP-1s are much more mainstream and we're starting to see a lot more adoption of GLP-1 therapy. Maybe can you dive into that a little bit for the audience? What do those other areas look like? How is it helping?
Absolutely. So you have to think of GLP-1s. It started with diabetes, then they moved to weight loss. Now they're basically seen as kind of a global metabolic modulator of your entire body for good health.
Yes.
And so there are other areas that, I'll kind of touch on quickly and not go into too much depth, but there's a lot of cardiac protection from the GLP-1s because they lower cholesterol, they lower the VLDL and ApoB particles, as well as decreasing inflammation, decreasing macrophages. So because of this, you theoretically would have smaller plaque formation with the less cholesterol, less VLDL, ApoB, and you'd have a more stable plaque. These plaques are formed by these small particles carrying the cholesterol. They go into your blood vessels, really anywhere in your body, but certainly in your cardiac vessels. And the macrophages eat the cholesterol. They go into the plaque. Plaque gets bigger. There's all these inflammatory pathways. So you end up with a growing plaque with inflammation. and the actual cardiac event is from an unstable plaque due to inflammation that ruptures. And so the GLP-1s decrease plaque formation, once again, theoretically, and as well as stabilize the plaque because you have less inflammation. So they're seen as something that could be very powerful in decreasing cardiac events over time.
It was interesting. Before this episode, we were just talking a little bit, and you mentioned a great statistic, and I forget the exact percentage points. We can definitely pull that up. Obesity rates for the first time in history have since decreased because of the introduction of GLP-1s and behavior
Right.
modification and everything else. I'd be interested some of these additional effects that you were just describing, such as plaque buildup, the cardiometabolic impacts. What do you think the next step is for us? Like, do you think we're going to start to see a significant decrease in some of these other risk states?
Yes. So, first of all, obesity leads to so many problems like
Yeah.
cardiac disease, sleep apnea, degenerative joints, joint replacement. So, GLP-1s affect obesity in a big way. So they decrease all of these comorbidities of obesity. But in addition to that, there are so many problems that they address that are unrelated to obesity. So they have effects related to the obesity and they have impacts that are unrelated to obesity. For example, most chronic disease in our body is created by chronic inflammation. The GLP-1s decrease chronic inflammation on multiple levels. The most famous one is the NF kappa B, which is this transcription factor that lives in the cytosol of a cell, and the GLP-1s prevent it from getting into the nucleus. If it doesn't get in the nucleus, it can't initiate all these cytokine pathways that cause inflammation. So, GLP-1s appear to have a huge impact on a lot of chronic disease independent of weight loss.
That is very, very impressive. And, throughout your career, you've been at the cutting edge of different surgical procedures, people traveling from all across the country because of the innovative ways that you were performing these surgeries and how effective they were. Everything that you've just described, and I think I know the answer to this, but do you believe that GLP-1s are really this innovative, cutting edge, almost like technology, but it's medication that is going to have and continue to have a profound effect on healthcare outcomes, throughout the world?
No question about it. As you said, I was in bariatric surgery and we had a big medical weight loss program at the time. But bariatric surgery was the only thing we had
Yeah.
that would impact these pathways. And I took care of literally thousands of patients for 24 years. But then as GLP-1s came out, the last year or maybe 2 years in practice, I was talking patients out of getting bariatric surgery if they only had to lose 50, 80, 100 pounds because the GLP-1s impacted these pathways so greatly. So that's why I ended up retiring 2 years ago and developing the whole GLP-1 program and becoming more of an evangelist for GLP-1s because they're benefits are so great and their side effect profile is so favorable, and they've been around a long time. And in my heart, I truly believe that anyone that is dosed right and stays on it can achieve their weight loss goals.
Love to hear that. And, something we hold near and dear to our heart at YourEra.com is whatever those goals are, whatever they may be, we're here to help you achieve them. So that is tremendous. You mentioned earlier at the beginning, our bodies are really hardwired, almost software from thousands of years ago that the scarcity type of mentality where we were searching for food, searching for the calorie denseness, and now we've really transitioned to a society where coming by food is not it's not as hard anymore, right? So that software is kind of outdated. Can you talk to me a little bit about how this helps a patient's willpower in dieting and exercising and being able to achieve those goals?
Yeah, for so long, people thought, "Oh, just force it, willpower, you can do it." And the reality is, you'll see these incredibly successful people in, financially, personally, relationship-wise, in every area of their life, but they couldn't handle the weight.
Yep.
And now we know. I mean, thousands of years of evolutionary programming. That is just, you know, you can't get over that simply by just forcing your will. You can do it short term, but to do it long term is, um, I wouldn't say unheard of, but pretty close to unheard of. So, today we know the science, it's biology. So this whole idea that people would be shamed for using GLP-1s is ridiculous
Yeah.
because GLP-1s level the playing field so that you can win the weight loss battle, get healthy, lose your weight, get rid of all that food noise, get rid of the hunger and cravings, which then positions you to make the good choices as you go through your life.
Yeah, from my standpoint, it used to be, and I remember when my wife's journey really early on, this is maybe like 4 years ago, and there was almost like a stigma or like
Right.
it's like, "Oh, we can't really talk about it. It's cheating or you're taking the easy way out." And it's definitely not the case, right? Like why would we not be adopting this cutting edge, new medication that's been clinically proven to help this scenario that's really like we have all the odds are stacked against us. So, yeah, love to hear that.
Yeah. From my standpoint, I like to deliver information that
Yep.
is going to be helpful to people. And I would say, the whole shaming thing, just forget about it. This medicine, which is a peptide, is going to help you lose your weight, get healthy, get rid of your medical problems, and give you the opportunity to live your life thin, healthy at your optimal function. Now, obviously, we have a whole program that is involved with everything else necessary to maintain muscle mass and bone density and get the right sleep and hydrate and avoid ultra processed foods, and we can get more into all that. So it's not simply the GLP-1, but without the GLP-1, patients don't lose weight and keep it off long term. We can talk about other areas that the GLP-1s help, like mitochondrial health. I mean, the mitochondria are a very important organelle in your cells,
Okay.
and they produce your ATP, so they produce the energy. They maintain metabolic balance. They're kind of they're the part of the cell that will signal when cells should die or
Okay.
not. They're big inflammatory markers. So GLP-1s make mitochondria healthier so they can more optimally perform in your body. And that is a very, very important aspect of the GLP-1s. One of the other things is cancer.
Oh, wow.
It appears that multiple cancers the incidence is decreased with GLP-1s. So there's a lot of studies going on in that arena also. The one other thing is the neuroinflammation. Um, the CNS is so impacted by the GLP-1s, but by decreasing the neuroinflammation and making the dopaminergic cells healthier, it appears that Alzheimer's and dementia can be reduced or put off. Parkinson's, there's hope for Parkinson's being improved. So the neuro changes that come naturally with aging which are really secondary to inflammation, could be significantly impacted by the GLP-1s.
Wow, that is really interesting. You mentioned the neurological benefits and the inflammation benefits, and I've started to hear about this topic of microdosing. So even if I've achieved my weight loss goal, I can continue to receive and get these other health related benefits by still continuing to dose GLP-1s. Is that right?
Yes. So once again, a lot of the evidence today is animal-based evidence, biomarker-based
Yeah.
evidence, but I would say the GLP-1s are so safe outside of, a certain things that we make sure those patients are excluded,
Yeah.
that a lot of our patients that hit their weight loss goals then switch to microdosing to keep their inflammation down, and to get the other benefits of the GLP-1s.
We're really starting to see a shift in this longevity medicine space and preventative care versus the reactionary care. And I feel like GLP-1s really fit into that health segment so well. Like where do you see this specialty area really going?
Yeah, interestingly, I was trained in Western medicine. I'm a surgeon.
Yeah.
I cut people open, fixed them. So, I was purely from the find a problem, fix it, mentality, which is our whole healthcare system.
Yes.
So our healthcare system is about not doing anything until people become sick and then treating them. So it's a very reactive disease treatment health system. And my brain today is about preventative care, meaning early care. And I really put that in. That's why I tell patients, you're the CEO of your own healthcare. So start early, take care of yourself so you don't have to get to the point where you need this chronic disease healthcare system that we have in the US. RFK on Rogan the other day had a
Yes, I
great
listened to that
line.
one.
He goes, "We have the worst environment to get people sick. If you live in America, you will get sick. But our healthcare system is the best in the world at taking care of you when you get sick." So my point is, I don't want to get sick. I don't want
Yeah,
to be
who wants to get
unhealthy.
sick?
So I'm going to do the things and help my patients do the things to maintain their health, their vitality, and live life to the fullest. I'm mid 60s. I climb mountains. I lift weights. I have fun. I do everything. And I plan to do it for a long time. So
Yeah.
that's what I want for all of my patients.
Preventative care versus reactionary care. And I think we're seeing a huge shift in our current healthcare system to one that's based on prevention. It is patient driven, consumer driven, where we have these goals. We want to prevent from getting sick, like you said, so we're able to go and search and get the care that we really need.
Yes.
Um,
It just quickly, our present healthcare systems has such perverse financial incentives to
yes.
treat disease. So all of the focus is on treating disease, not on the preventative side of medicine, or the preventative side of being the healthiest you can be at any stage of your life. And so we try to empower our patients to understand that, so at any age they can optimize their health and do the things now that will prevent you from becoming part of the disease treatment system that we have here in the US.
Yeah, it's almost like an endless flywheel that, once you're in there, it's tough to get out, right?
Oh, yeah. So GLP-1s are, present. They're peptides that are present in the body. They're released by the L cells of the distal ileum and colon
Okay.
in response to food. So they are broken down within 1 to 2 minutes by an enzyme called DPP4, so that they're quickly inactive. So they're episodic after you eat. So the GLP-1s that are now being developed have things to make them resistant to the DPP-4,
Wow.
so they cannot be broken down, number one. And number two, they also have a long half-life because the semaglutide, for example, binds to albumin because they add a free fatty acid on one of the amino acids. So the semaglutide will stay in your body for a long period of time, and it lasts for up to a week. So you went from the endogenous in your body natural GLP-1s that last 1 to 2 minutes to now we have GLP-1s that last for a week. So that has profoundly changed the playing field and help people take something that can remove all the food noise, take away the hunger and cravings all of the time.
Wow. That's really, really interesting that, there's a lot of talk out there around compounded, personalized GLP-1 medications where we're really perfecting the dosing to be the optimal to my specific body or your specific body. How is that related to the science of GLP-1s being able to now last up to, a week within your system for you to be able to receive these ultimate benefits?
I think personalized care is very, very important when it comes to all healthcare. But in the GLP-1s, dosing needs to be personalized. You shouldn't be on auto titration where you automatically go up every month. You have to listen to your patient. And once again, that's why we've developed this green zone concept and empowered patients to listen to your body. Tell us if you're in the green zone, which of course means you have no food noise, your hunger and cravings are minimal, you're losing 1 to 2 pounds a week, and you're in the sweet spot. So if you are, we're not going to increase your dose. We're going to keep that dose at a low point. You will notice over time that you slide back into the yellow zone, which means food noise starts coming back, hunger and cravings come back. You're starting to get your impulsive urges to eat things late night or eat ultra-processed food, and that's when you need the bump in your dosing.
Okay, so you've talked a lot about evolutionary care, talked a lot about the impact of GLP-1s and kind of where they're taking us. Where do you see the next 10 years going? You've seen a lot of shift and transition in healthcare throughout the last 30 plus years. Now with GLP-1s and more cutting edge therapies, where do you see the next 10 years really going in this space?
I see people embracing the new care model of preventative care.
Okay.
Once again, I tell everyone, you are the CEO of your own healthcare.
Exactly.
So take charge. Don't take what, the world is giving to you, which means you need to embrace, making the right choices early on as far as, avoiding ultra-processed foods, staying thin, getting sleep, getting your hydration, exercising. You want to do all the things to make your body the healthiest, most functional, best vitality to live your life where you never need our great healthcare system.
I love that. I love that. Tom, we have covered a lot of ground, a lot of science. We've really, really unpacked a whole lot during today's episode. If there was one thing that you wanted all the listeners out there to walk away with from today's episode, what would that be?
I would say this because I hear a lot of people say things like, now granted, there are so many people getting benefits from GLP-1s, losing weight. It's shocking. We see them all over. But I hear people say, it didn't work for me. And I kind of chuckle because the reason it didn't work for you is because you didn't have the guidance or the tools to understand how to make it work for you. GLP-1s, in my mind, will work for anyone if they are dosed appropriately, have guidance, and have a program that they can work in.
Yeah, and that's really interesting you say that, because the next episode that we're going to be diving into is precisely that. How GLP-1s fit into a holistic program to really maximize and get the biggest results from these medications. So really excited to dive in there.
Great. All right.
Tom, thank you very much.
Yes.